As we get older, our bodies change. It's a natural part of life. Sometimes these changes bring new things to our attention. Varicose veins are one of them. Many people see varicose veins appear as they age. But what are they? And should you be worried? This guide will explain everything you need to know about varicose veins in a simple, clear way. Think of this as a friendly chat about a common issue. We're going to break down the causes, symptoms, and treatments for varicose veins. We'll also discuss ways to prevent them. Knowledge is power, and understanding your body is the first step to feeling your best. Remember, this guide is for information only. It's not a substitute for talking to your doctor. If you have any concerns about varicose veins, always consult a medical professional for personalized advice. Let's get started. Picture your veins as highways. Imagine the veins in your legs as a network of highways. These highways carry blood back to your heart. To keep the blood flowing in the right direction, your veins have tiny valves. These valves act like one-way doors, making sure blood doesn't flow backward. Now, imagine some of these highways getting a little bumpy and twisted. That's what varicose veins are. They happen when the valves in your veins weaken. This weakening allows blood to pool in the veins, causing them to bulge and become visible through the skin. These bulging veins can be blue, purple, or even flesh-colored. They might look like twisted cords just beneath your skin. While they're often painless, varicose veins can sometimes cause discomfort or signal other health issues. So, why do these vein valves weaken in the first place? There are several reasons. Sometimes it's simply genetics. If your parents or grandparents had varicose veins, you're more likely to develop them too. Age is another factor. As we get older, our veins naturally lose some of their elasticity. This makes them more prone to stretching and valve problems. Pregnancy can also lead to varicose veins due to increased blood volume and pressure on the veins. Standing or sitting for long periods can also put extra pressure on your veins, making them work harder. This can weaken the valves over time. Finally, being overweight or obese can also increase your risk, as the extra weight puts more strain on your legs and veins. Now that you understand what causes varicose veins, let's talk about how to recognize them. The most obvious sign is the appearance of bulging, twisted veins, usually in the legs and feet. These veins might be blue, purple, or flesh-colored. You might also feel a heaviness or aching in your legs, especially after standing for a long time. Some people experience swelling in their feet and ankles. Itching around the affected veins is another common symptom. In some cases, varicose veins can cause changes to the skin. You might notice your skin becoming dry, itchy, or irritated. The skin around your ankles might even become discolored. These symptoms are a sign that you should consult a doctor. Potential complications. Why it's important to address varicose veins. While varicose veins are often harmless, they can sometimes lead to complications. One such complication is chronic venous insufficiency. This happens when the valves in your veins are so damaged that blood has trouble flowing back to your heart. Chronic venous insufficiency can cause leg swelling, pain, and skin changes. In severe cases, it can even lead to ulcers on the legs. Another potential complication is blood clots. Because blood flow is slower in varicose veins, clots are more likely to form. These clots can be dangerous if they break loose and travel to the lungs, causing a pulmonary embolism. While these complications are rare, it's important to be aware of them and seek treatment for your varicose veins if necessary. Diagnosing varicose veins, a simple and painless process. If you're concerned about varicose veins, don't worry. Getting diagnosed is usually a simple and painless process. Your doctor will start by asking about your medical history and any symptoms you're experiencing. Then, they'll examine your legs and feet, looking for visible signs of varicose veins. In some cases, your doctor might recommend a non-invasive ultrasound. This test uses sound waves to create images of your veins, allowing your doctor to see how your blood is flowing. The ultrasound helps determine the severity of your condition and rule out any other underlying issues. The good news is that diagnosing varicose veins is usually straightforward. Your doctor can then discuss the best treatment options for you. Treatment options, from lifestyle changes to medical procedures. The good news is that there are many effective treatments for varicose veins. Your doctor will recommend the best approach based on the severity of your condition and your overall health. Sometimes simple lifestyle changes are all that's needed. These changes might include losing weight if you're overweight, avoiding prolonged standing or sitting, and elevating your legs whenever possible. Wearing compression stockings can also help by applying gentle pressure to your legs and improving blood flow. If lifestyle changes aren't enough, your doctor might recommend medical procedures. Sclerotherapy involves injecting a solution into the veins, causing them to shrink and fade away. Laser treatments use heat to close off the veins. These procedures are minimally invasive and can significantly improve the appearance and symptoms of varicose veins. Preventing varicose veins. Simple steps for healthy veins. While you can't control all the factors that contribute to varicose veins, there are steps you can take to reduce your risk. One of the most important things is to stay active. Regular exercise, even just walking, helps improve circulation and keeps your veins healthy. If your job requires you to stand or sit for long periods, make sure to take breaks to move around and stretch your legs. Elevating your legs whenever possible can also make a big difference in reducing pressure on your veins. Maintaining a healthy weight is crucial, as excess weight puts extra strain on your veins. Eating a balanced diet and getting regular exercise can help you achieve and maintain a healthy weight. Remember, small changes can make a big difference in preventing varicose veins. Taking charge of your vein health. A proactive approach. Understanding varicose veins is the first step to taking charge of your vein health. Remember, this is a common condition, especially as we age. By knowing the causes, symptoms, and treatment options, you can make informed decisions about your health. If you're concerned about varicose veins, don't hesitate to talk to your doctor. They can assess your individual situation and recommend the best course of action. With the right information and proactive care, you can maintain healthy veins and keep your legs feeling their best. Remember, you're not alone in this journey. By staying informed and taking care of yourself, you can enjoy your golden years to the fullest.